Month-long waits for GP appointments hit a record high last year, according to new NHS figures. That's despite Rishi Sunak vowing to cut waiting lists as one of his 5 key pledges. One in 20 patients had to wait at least 4 weeks to see a GP in England in 2023, with patient groups claiming the figures show how the family doctor is fast becoming an endangered species. The NHS insists it's delivering more GP appointments than ever before, but with a health service crippled by continued strikes and doctors' surgeries flooded with patients whose hospital procedures have been cancelled, fewer appointments are being delivered. The government says it has met its target of 50 million additional GP appointments last year, but critics claim we'll soon see GP deserts similar to the dire situation with NHS dentists. Well, this is yet another one of Rishi Sunak's key pledges falling by the wayside, isn't it? He was stupid to make these 5 pledges, and he's absolutely failed to cut NHS waiting lists. And he may be claiming that there are 50 million more GP appointments, but GPs themselves are saying they have less and less time for patients and less, more and more admin and all of that. To me, the term family doctor has become meaningless, completely meaningless. I can't remember the last time I saw the same doctor more than once in a row, more than twice in a row. GPs have no kind of history. They don't know their patient's medical. They don't know your children. They don't know your history. There's no continuity of care. So you waste time each time telling the same doctor the same issues if you have, say, a condition that you need to talk to a doctor about. And again, when patients can't see a GP quickly, they end up in hospital. They end up putting more pressure on A&E. So we have this revolving door. I think it's an absolute crisis. And I think GPs need to start working a 5-day week again.
Yeah, I think it is. I think it's an absolute crisis. I agree with you.
Most GPs are working a 3-day week.
Yes, but I think it is an absolute crisis. But I actually think it's worse than that, because what this has done, the lack of GPs, has been long in the making, and that has fueled this demand for A&E services. That has fueled the problems within hospitals. That has confused the public as to what our NHS is there to do. And also, I think we've failed to use technology in the sense that online doctors, I think, could deal with a lot of situations that, frankly, I would say quite often you possibly know what's wrong with you, and do you really need to go and sit in a doctor's surgery every single time you've got a cough and a cold or flu or a temperature or whatever it may be? Now, does that mean that online is a solution? No, but we should be using technology to help doctors deliver a better service. We should be making sure that there are more GPs available, and we haven't. We've denigrated the system that we have, and also because medicine has become much more complicated, it means that GPs have to know more, do more, and be able to prescribe more in all sorts of different ways. And I think that has led to a crisis within the NHS and pharmacists.
Often you go and you're trying to get a GP appointment because you need antibiotics for something. For example, a pharmacist is a very experienced person who's been working. They train for years. I think they train for 7 years. Pharmacists could be delivering a lot more, and I know there is a plan to use pharmacists more.
Every time we talk about the NHS, it's like rearranging the deck chairs on the Titanic. We never talk about the NHS in the sense of this is a service that we are paying for. We are paying a lot of money for with our taxes, and yet we're not receiving that service. Oh, it's just about tinkering around the edges, removing pension caps for doctors so they don't retire early and all of that. The NHS is not working. And in any other context, if we're receiving a service, we think, okay, where can I go? What are the alternatives? There are no alternatives to the NHS. So we're stuck with this creaking system. So every time we talk about it, it's like this national religion. Oh, all you have to do is pump more money. All you have to do is ship in some nurses from the Philippines, and then we'll be fine. Let's talk about fundamentally changing the NHS so that if you need medical care, you don't have to rely on this broken creaking system that we're forced to fund. It's not working.
A lot of people have been saying, Wes Streeting said this several years ago, that, it's not the sacred cow anymore, that we need to be brave enough. Politicians need to be brave enough to question the model, to question whether people should be fined for not turning up. No, because they don't think...
Wes Streeting won't be either.
And he won't be either.
Exactly. Every politician talks big, but they're not going to do anything about it.
But also, primary care is quite different.
They don't see us as customers paying for a service. They see us as morons, continually happy to fund this creaking service with our taxes. And until we actually demand a service that works, nothing is going to change.
I mean, I'm so old, I can remember, when I was a kid, my mum would phone up the GP and say, Kevin's really sick, and the doctor said, well, I'll be round at 5. They used to come round and visit.
Family doctor would come round.
Visit, or to go around the whole village or the whole town at night. How have we got from that to what we've got now, where if you're lucky, you get a phone call through? The other week I wasn't very well, and I wanted to see my GP. The best I managed was to get through to the reception, who started saying, well, exactly what's wrong with it? I've got a cough. What kind of a cough is it? I said, excuse me, when did you take your medical degree? I mean, it is ridiculous.
Kevin, try fighting for an appointment for your 3-year-old who's sick. Do you know what I mean? There should... A poorly child, like when I was a child, they would come round. The family doctor would come round at the end of their shift.
Most of these doctors are going to private medical care, because if you pay, I don't know, like £70 a month for private medical insurance, you actually get to jump the queue. Yeah. And this is an idea that Tony Blair proposed. Well, yeah.
70?
Depends on your age. For the older people, it might be more. But you could actually jump the queue.
Might be more. You 70 quid a month for private health insurance.
I'm 27 and healthy.
They're not going to look after you for that.
I don't need to pay that
Which decade are you talking about? The 1970s?
You haven't got private health insurance,
anyway,
have you?
That's besides the point.
Emma?
Yeah, well, there was some really interesting... I don't know if you guys saw recently the findings, the study yesterday, showing that exercise is far, far more effective for depression and for anxiety and all of that than antidepressants. It's been proven.
Yeah, of course.
Far more effective to go for a walk or go for a run than to take antidepressants or do cognitive behavioural therapy.
Can I ask you a question about that?
Anyway, can I just...
the question about that...
Can I actually just finish what I was saying, which was table tennis? Table tennis, on that point, table tennis is now going to be prescribed on the NHS. You could be served up a course of ping pong if you do actually manage. It's not ridiculous at all. It's called social prescribing.
Well, but the thing is,
because I've just explained.
Then join the queue.
Okay.
Let's finish the cue card.
Yeah.
Doctors are being encouraged to do more social prescribing, which involves telling patients to try healthy activities like gardening, painting, cooking, and sports instead of relying on medicine. What's wrong with that?
No, it's common sense. Why do you need a GP appointment?
Exactly.
That's why it's ridiculous, not because the GPs are wrong.
This is the question I wanted to ask, which is,
it,
why have we ended up where the NHS is suddenly prescribing things which are a combination of common sense, and also, where is the self-responsibility for realising what it is that you are supposed to do to look after yourself?
Yeah, but that's like saying don't bother telling obese patients to lose weight. Yes, of course people should do it, but this is the situation that we have.
Yeah.
And therefore, doctors are going to say things like, maybe get out more, maybe do some gardening, maybe get out into the fresh air. Well, yes, but if it's effective, it's better than putting them on medicine.
Why should I taxpayers' money for them to do that?
Exactly, because they have to book an appointment to meet a doctor.
You're a doctor.
Well, why don't you just scoff at fat people and people who are depressed?
Nanny state claptrap, that is. I mean, prescribe me medicines, not gardening. Absolute nonsense, in my view.